Okay, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified quite a bit, 30 or 40 times. And right now, we're looking inside the joint. You're laying on your side, and we can see that you've got a lot of inflammation in the shoulder. It tends to be very vascular and kind of red looking. So we're going to start with our shaver here in just a second. If you can bump our systolic down just a little bit, that'd be awesome. Okay, so we're going to go and put our shaver in here. We're going to clean up some of the synovium that you see here so we can get a better view. Just wanted to show you something interesting here. Lift up on the shoulder, straight up. As we look in here, we can see you've got a large piece of cartilage that's basically coming off of the humeral head here. And I'm sure that was accounting for a lot of symptoms that you were describing. Clearly it was keeping the joint very inflamed. We're going to have to attack this by putting the shaver in the posterior portal in a minute, but I just wanted to show you what we're looking at here. See that? This is the posterior aspect of the joint. There's that piece of cartilage that's hanging down. We don't want to get too much into the vascular stuff until we have pressure down a bit. We'll keep working and show you some more in a little bit. Okay, so we're just working now with the shaver in the posterior portal. Just working on this humeral head here. We don't want to remove anything that's loose, but there is a large, lift straight up if you can, but there's a large part that's loose. And as we get that removed, it's starting to look more like a shoulder. There's a big piece right there. You can see this hanging down here. That's not good. So we're just making our way around the periphery, just making sure we've got all of the loose cartilage removed. Okay, so we're looking here at the biceps tendon. This is the tendon running up towards 12 o'clock on the screen. This is the backside of it. As I pull down, it's inflamed, but it's not torn. You can see some redness there as it exits the joint at the top of the screen there. So again, inflamed but not torn. And this is the leading edge of the subscapularis tendon here. That looks okay. So you have a lot of the features of a frozen shoulder with all the redness, but that's because you've had a couple things going on inside the joint here with that big cartilage flap. Hold it. Can you reach underneath and hold the shaver here? So you have that big cartilage flap, which is now gone, but as a result, you can see that you've got this area on the humeral head that's missing cartilage all the way back to there. So that's something we'll talk about in the office later. There's nothing else loose here, so we've got all the loose parts, but it's essentially the entire weight-bearing portion of the humeral head. So now we're going to look up at this rotator cuff tear. Hold the shaver again. We'll rotate and look over here, and here's the tear. This is all exposed footprint here. So the next view we'll show you will be in the subacromial space as we get to work on fixing this. Okay, so we're getting a good look here at the tear now. This is the tear. As we lift up and look to the left, there's the biceps tendon underneath. There's the articular margin. This is the lateral aspect of the footprint, and here's the hole. So I think we're ready to start planning our repair, which we do by taking a spinal needle and that looks like it's going to be a pretty good shot there. I'm just trying to judge how many anchors we think it's going to be. It looks like if we can get this down something like that, that'll be a good place. Okay, here you can see we've got our sutures in. I'm tugging on the anchor to make sure it's seated. And you can see I can pull the entire humeral head just by pulling on those sutures, so it's very strong. And now in order to get our implant in, we're going to take the crochet hook and take some sutures out right here. Okay, we'll show you some more in just a minute. Okay, here you can see how we start to tuck the patch down. The patch sits above the bone underneath the tendon. So the bone is underneath, under there. We've got the patch tucked all the way up to the articular margin there. I like the way that looks. This is the posterior leaf of the cuff. We're going to bring this way over here like that. And we've got a little bit of a dog ear there, but we're going to take care of that in just a second. So I'm happy with the way the patch is laying. We'll show you some more in a minute. Okay, so here we're going to take our suturing device. It's loaded with a black wire called a super shuttle. You can see it coming out of the tip there. And we like to see exactly where the tip's going to come out first. Hold right there. So we'll take that bite there. Okay, so we've tied one of the sutures. This is the most posterior suture. There's the knot right there. And you can see how that's really snugged down the tendon to the bone right on top of the rhodium. That looks really good. We're going to tie this blue and white one next. Once we pass it, we're going to use a suture hook to make a stitch right about here. Okay, so we've passed but not yet tied this set of sutures. They're going to sit just about like that. And we've still got one more suture to tie. You can see how we're getting our implant down. We're going to tuck that underneath in a minute. Okay, so the final suture we will pass anteriorly. We'll show you that in just a second. Crochet hook. Okay, so we're done. We've got everything tied. You can see crochet. Yeah, you can see how the implant is down here. And I'm happy with the way that looks, okay? As I rotate your shoulder, that looks pretty solid. Okay, so we're going to finish up here and get you back to the recovery room shortly. Bye-bye now.